morning. Welcome to the Hartford Next webinar series, It's Your City. Today we are featuring the Departments of Health and Human Services, as well as the Department of Public Works. And we are glad that you are able to join us. I'm Marion Griffin, Board Chair for Hartford Next. I'm your host for today's webinar. And we also have individuals here who can help if you want to hear this in Spanish or you want to say anything in Spanish and have it interpreted for you. So what I'd like to do is welcome you again. Our co-host today is Lindsay Ewing. He is the Hartford Next board member and also a member of the West End Civic Association. And he's going to provide you with tips on how to participate in today's webinar. And I'm going to share my screen so that you can actually see some of what he's going to be sharing with you. So Lindsay, welcome and thank you.
Thank you. Good morning, everybody, and thanks for joining us today. So just so you know, so as Marion said, this is a webinar and it's one way. You will be muted and can't share your video. However, if you have a question, please use the Q&A feature within Zoom. You'll find the button at the bottom of your screen. There is also the chat feature as well if you just want to share some general information. Unfortunately, we don't have the live Spanish translation available this morning. So if you do have a question in Spanish, please feel free to add it to either the chat or the Q&A, and our interpreters will translate that, and we will make sure that the panelists respond to your question. After the event, slides will be sent out to everybody, and there'll be a survey, which we'd really appreciate it if you complete after this. Thank you. Back to you, Marion.
Thank you very much, Lindsay. So today, we're going to tell you a little bit about who we are, that is the Hartford Next, before we get into our topic today. And so this is just a general rundown of our day. We will be finishing at 11:30, and we value your time today. So with that, let me just tell you a little bit about who Hartford Next is. Hartford Next is the coalition of neighborhood revitalization zones, and there are 13 in Hartford. In addition, we have other representatives from other organizations that are also part of Hartford Next. So you can see the logos here of our various NRZs, very interesting. And if you're not a member of your neighborhood revitalization zone, or you would like to know more about them, you can go to our website, and that would be put in the chat, where you can actually find out the location of your neighborhood revitalization zone. So our mission is to be the collective voice of Hartford residents and stakeholders, and we are working together to strengthen and grow the community to make it better. And so our purpose is to really create an environment where there is a possibility of listening, encouraging, discussing, negotiating, and leading to actually make change and help us make the community a lot better. Not saying that it's not, but there's always room for improvement. So the Neighborhood Training Institute is actually sponsoring this event. This is the communication and education platform of Hartford Next, which was established in the early 2000s. We sponsor seminars, workshops, programs, and formal, informal training for residents. And also, so then today we are really focusing on our health, well-being, and quality of life, and also with the Department of Health and Human Services and the Department of Public Works. This happens to be the 6th in our series of 8. We have 2 more to go, and you'll hear more about those by the end of the workshop. So to start today, again, this is the organization, and you notice that the city of Hartford in terms of the organizational chart. You notice at the very top, residents. You as residents, we as residents, the city departments, they actually work for us. We pay taxes. And so it is good for us to understand what they do for us and how we can be supportive of them. So again, today we're talking Public Works and Health and Human Services. So today I'd like to introduce our moderator. This is David Mcdonald. He is the Executive Director of Asylum Hill Neighborhood Association, which is one of our NRZs. And he has served in various capacities within the community. And you can read this, you'll get the slide deck, so I'm not going to read through all of this, but he has served working for the state, has been a council member for the city of Hartford, and has also served on the Board of Education. So very well versed in the community of Hartford. So David, I'm going to turn it over to you. And thank you so much for joining us today.
All right, thank you and good morning, everyone. Looking forward to this wonderful webinar. We're going to be hearing from a couple of different people. Carmen Shaparo, who is the project leader in Health and Human Services. She leads the department's human resource and budgeting processes, beginning her position in 2018. Prior to that, she was managing the Hartford Teen Pregnancy Prevention Initiative, as well as working on the health equity and acting supervisor of the Department of Families and Children, Youth and Recreation. The previous organization of that department, I believe, or one of the different departments. She's also served as a board member of the Hartford Job Corps and on the Governor's Early Childhood Alliance and a facilitator of Parent Leadership Training Institute. So that's a really great background for Ms. Shaparo. Working with parents, the community, and with our city government. She has received her BA and degree in psychology and elemental education from Guilford College in Greensboro, North Carolina. Her MS degree in organizational psychology from the University of Hartford. So welcome, Carmen. Thank you for coming. Next slide, please.
Where do you want to go, Dave?
Yeah, I guess to Michael's slide, I guess.
Okay, sure.
Yes, Michael. So we're also going to be hearing from Michael Looney, the Director of the Department of Public Works.
Yeah, I'll just keep talking and I'll get there.
And I know Michael's been here for a few years as Director of the Department of Public Works. I'm not sure when you started, but at the top of my head, but you've been here for a number of years. And I think a lot of us can attest to seeing some improvements in the department after many years of maybe not seeing many improvements. So it's been really a breath of fresh air, your leadership, Michael. Really appreciate that.
Thank you.
So anyway, I think I don't have your bio in front of me, so
Well, it should be,
there it
should
comes.
be coming.
Yep, hired in 2017. Deputy Director from 2017 to 2020. Let's see,
I'm sorry.
I'm all over the place here.
I'm sorry, I'm having technical difficulties today.
It's okay. Technology is not always our friend. Yeah.
Yeah.
So I think, do we want to get started?
Well, let me just, I'll throw this
You gotta
up.
get this up anyway.
Yeah, here we go. There we go. Can you see it?
Not yet.
Oh, gosh, I'm sorry. This will do it.
There it comes.
There we go. Did I do it?
Yes, you did it. It's up. Yep.
Okay, thank you. Sorry.
Okay. So Mr. Looney has extensive experience in urban planning and development, served as a consultant for many years, joined city's Department of Public Development Services in 2014 as Director of Projects. So he's got experience in both Department of Development Services as well as Department of Public Works, which is really good because we need cross-department knowledge in this city. So one of his primary responsibilities was project management for the Dunkin' Donuts Stadium project. That was a big job. All right, so let's, I guess, move on to our presentations. Are we ready?
Yes, go ahead. David, go ahead.
Yep. Okay, so starting with Carmen Shaparo, would you like to begin your presentation?
Sure, yes. Good morning. I'm Carmen Shaparo, and thank you for having me here this morning. I do want to give a shout out to our director, Liani Arroyo, who would otherwise be here with you, but is in Texas right now as part of a presidential leadership program that she is on. So we applaud Liani for her incredible work. And she's part of the presidential leadership program because of so much of the amazing things, so many of the amazing things she's done here on behalf of the city of Hartford. So we'll start really quickly. There she is.
Yes.
Thanks, Miriam. All right, so if you'll just move to the slide with our mission on it. We are the Department of Public Health and Human Services here for the city of Hartford. We aim to protect the well-being of city residents and promote the environment that is conducive and healthy to our residents' lifestyles. Our primary focus is prevention of adverse health outcomes through the provision of quality services. And we'll talk a little bit about the many programs and services that we do provide out of this office. Next slide, Miriam. Okay, so here is an example of our one of our org charts. What makes our department gravely unique is that, as you will see, this is a color-coded chart. We are predominantly grant funded here in our department. Our general fund contribution, meaning taxpayer dollars, cover just about $5.5 million of our yearly operations. The rest are through local, state, and federal grants that we compete for on an ongoing basis. Just this year alone, we'll be rewriting for, I believe, 4 different grants that we have here in the department. So that is a huge function of what we do here at the department. We have 4 programs that you'll see: the Dial Ride program, the emergency shelter programs, the community needs assessments, and our finance unit. Our general fund unit, we have about 10 programs. So we have our maternal and infant outreach program. We have our senior centers, our warming shelters, our relocation program, and our renters rebate program, which are 2 really large programs out of our office. We also have our nuisance and rodent control, as well as our food and safety. We also license all of the swimming pools in the city, all of the school cafeterias in the city. We manage all of the public health code enforcement for the city, and we manage licenses for our food establishments, our bodegas, our salons, our barbershops, our tobacco distributors, et cetera, et cetera, et cetera. All of the places at Dunkin' Donuts Park where you get your food. The lovely stadium that Mike helped with. So here with our grants program, you'll see under our disease prevention and health promotion unit, we have a public health clinic that has the Ryan White Part A grant. We also just secured for the next 3 years, the Ryan White Part B program. We have a grant that allows us to do STI and HIV testing and maintenance. We also have a state grant that allows us to track and do TB work, tuberculosis work. So we typically, if there is a tuberculosis case in the city, it comes to our department and we manage it and we follow it, we treat it from beginning to end. And then our health block grant for fall prevention. So we work with our senior population and our home health program to help prevent safe environments for our seniors inside of their homes, to prevent any falls or anything that could really set back a senior. Another large grant that we have from the CDC is our REACH grant. So our REACH is Racial and Ethnic Approaches to Community Health. This grant is focused at looking at the overall health of a community. In particular, they are focusing on safe streets, healthy biking paths, walking paths. So this spring and summer, you'll see that they'll have a lot of Saturday morning walkabouts throughout the city. So really exposing residents to safe ways that they can exercise and stay healthy, working with young families to access services throughout the city, also working with young parents on breastfeeding efforts with their babies, and both prenatally and then after, once they have their babies. We also have a Healthy Start program. So our Healthy Start program and our MyUp program and our REACH programs all kind of work hand in hand. Again, it's looking at and following a parent from prenatal health all the way through 3 years of age. All of this is done through home visitation. So you can imagine the last 2 years for them has been challenging, but they've been able to do a lot of, remote work with the clients, and we've been able to actually retain a really great number of clients who have stayed with us and continue to work with us. Our teen pregnancy prevention program is currently not active. That's a great example of how grants come and go into the city. We were reauthorized. We received a grant in 2010, and then we were reauthorized again in 2015 and reduced the rates of teen pregnancy in the city of Hartford by nearly 40% at the time. And so currently those funds do not exist here in the department, although I have lots of staff who really would love to see that come back. So we will actively continue to look for that work. Another one of our largest programs here is WIC, the Women, Infants, and Children program. We have 2 offices. One is located here at the North End in 131 Coventry Street. The second is over on Main Street in the Hispanic Health Building. Both offices have nutritionists, nutrition aides, and staff that work with mothers from prenatal care throughout the first 5 years of their child's life, providing various WIC benefits to help maintain the health of both mom and children and dads. There's an active fatherhood program that they are running out of the WIC office as well. We have several NCAA grants. So for our seniors, we have our home help program, where we have home visiting nurses that will go into homebound seniors and assist them with their basic needs. We have a Keep on Living program, which is designed to help seniors keep moving. It's run through our senior centers, and it's done both in person and remotely. So we have individuals who teach Tai Chi, different movements. They might do weightlifting. It depends on what the seniors need and would like in terms of movement. And then our elderly nutrition services. I know that there's a question that we might get to about that a little bit later, but this is the funding that allows us to provide healthy meals to the seniors when they're at the senior centers in our community. So you'll see the general fund programs we already went through, and that one in purple, the Hartford Fights COVID, which we could probably spend a good 2 hours on, but I know that there are some questions related just to COVID. So David, we can, and Marion, we can go to the next slide. Okay, we basically operate by the 10 essential public health services. I'm not going to take too much time on this slide, but as you can see, it's, we're really looking to do prevention. We really want to, our efforts here at the department are really geared towards trying to, keep our residents out of emergency rooms, out of doctors' offices, wherever possible, by helping to mitigate some of the more severe and chronic health conditions that our residents tend to have and tend to deal with. So all of the programs that I just went through really aim to address these 10 essential public health services. Next slide. Okay. So our focus really over the last 2 years has been COVID-19 response. As you know, we have worked very closely with other city departments in the mayor's office to roll out COVID mitigation strategies for residents, for people visiting our city, and for our staff that work here in the city. We're constantly writing grants. The last grant that we received, I told Leonie that I wasn't going to write anymore because it's exhausting, but we are literally writing grants all the time, and really trying to bring money into the city and into our department. And that is really driven by the needs of the residents and the needs of our city and what the data is showing us. We are just working on some internal controls, building up our staffing, and that's been a big challenge. We are not exempt from what is happening across the country of people shifting and leaving jobs and starting new people. So we're still, and it's kind of a rebirth, a renewal for us, and really trying to reestablish and build some of those internal controls, particularly as we sort of try and balance out work from home schedules and schedules for staff who have family members in quarantine and children in quarantine. So I'm sure that we can all connect and attest to how challenging that can be sometimes. And we consistently prioritize our social determinants of health. So really looking at how different populations of people in our city are impacted by the policies and the strategies that we use to bring healthy behaviors into our city. Okay.
All right, thank you, Carmen. So those of you watching the webinar, you can chat, you can type in any questions you have into the Q&A button at the bottom of the screen. I have some general questions here I can follow up with right now. So Carmen, what are the COVID-19 services for vaccinations and testing, and where are the sites where residents can find these services?
Great, thanks, David. So there are multiple services throughout the city. We partner with a number of different agencies. You can find the information about testing sites and vaccination sites. Usually they're posted up on the community, Janice's office, the community outreach office, and 311 also has that information. We also post it on Facebook daily, sometimes once or twice a day. We're on Twitter as well. And if you follow the Hartford Health Department on Facebook, that's, generally we will post the week's schedule for all of the testing sites and the vaccination sites that we know are operating that week in the city of Hartford. As I'm sure many of you have seen, there's been a huge shift just from the number of people that were waiting in lines for testing in December, right before the holidays, versus how many people are actually in line waiting for testing services right now. As far as the health department is concerned, we have a health clinic we have a vaccination clinic that we hold here at the department. We offer all 3 vaccines. We offer boosters, and that clinic is on Wednesday nights. Currently, it's operating from 4 to 8 p.m. In the month of March, we'll back up the hours from 4 to 7 p.m. So we have vaccinations here and available. We also partner with Sasa Home Health Care, and they will do vaccinations for homebound residents. So if we have residents that can not leave their homes or have, it's very challenging for them to leave their homes and to make it to a space to get a vaccine, we also have Sasa's crew that goes out and does vaccinations in the home.
Great. Thank you. Given the diverse services provided by HHS, how many EEs provide the services, and how do you use the resources of other service providers?
Great question. We actually, so as you saw with our org chart, it is, ever changing depending on the grants that we have, depending on the funding that we have. We're, very grateful that our general fund funding has remained pretty consistent. We have about 50 full-time employees currently. We have about 15 vacancies at the moment, and that's inclusive of both our general fund and our grant positions that we have. We also partner with community agencies. So all of these grants that come into the department, the money doesn't necessarily sit here or stay here with the department. We manage, and we are a fiduciary agent in some instances, and we put many dollars out into the community agencies. So as an example, MyOp is one of those programs, Healthy Start is one of those programs. So all of those employees are, and one of our COVID projects as well, all of our CHWs, our canvassers, they're all contracted employees who actually work for other agencies but reside here at the health department doing the work on behalf of the various grants and programs that we have as well.
Great, thank you. How does your department interact with state or federal departments or other city departments or programs?
So obviously through all of our grants, any grant that is state funded or federally funded, we're, very active in building those relationships with our funders. As far as, other city departments, we really can't do our work absent of other city departments. So as an example, during COVID, we've worked very closely with Mike and his team at DPW and the mayor's office and the public schools, and Kim Oliver's shop over the Department of Families, Children, Youth, and Recreation, and with City Council. So much of the work that we do is really dependent upon us, supporting and being supported by other city departments. So the directors meet regularly, weekly with the mayor's office and are really, let each other know the big projects that are happening. Oftentimes we will write each other into grant applications and proposals, just to be able to, intertwine our work as much as possible and to make access for residents as easy as possible by doing that.
Great. One last question for you. And just a reminder to our attendees, if you have any questions, please type them into the Q&A box button at the bottom of your screen. I have one last question for you, Carmen. What have been your office's challenges in delivering the services that residents and you expect from your office, and what is in place to overcome those challenges?
I'm not sure. So, like I mentioned a little bit earlier, some of the challenges have been, staffing. It's been over the last 2 years, I can say that that has been a bit of a challenge. We have some grants that come in that are, really rapid and for a short period of time. And so in order for us to get that project off the ground, it takes a lot of people power to make that work. And certainly with COVID, part of it has been community trust and outreach, particularly now, is really trying to get our residents to be educated around the risks of COVID and of contracting COVID, and also of ways to mitigate that. Even whether you choose to be vaccinated or not, it's really, trying to get that education out into the community and building trust with our community to be able to do that. One of the ways that we're trying to mitigate that a little bit is on Saturday mornings next weekend, actually on Saturday on the 26th, we partner with UConn Medical Center, and they also, and UConn School of Public Health, who partner with various pharmaceutical schools and other other agencies throughout, and we basically pound the pavement. We walk, we're out in both the north end and the south end. We have our portable coolers with vaccine, so that we're able to offer people, vaccines and information and education where they're at. So we may, knock on someone's door to be able to provide that information, or we may be, sitting in front of Bravo or another agency providing that information. So, really the challenges are, I think right now, trying to project what we might see in the next, 3 to 6 months, and really prep for that. And I think that the last 2 years have really challenged us in a way that has, made us prepare for anything, right? It's kind of anything goes. And so it's really allowed us the opportunity to really think about our emergency preparedness and how we respond to, a community-wide pandemic or a community-wide issue at all. So, I think that those are some of the challenges, and just getting people, motivated to continue to do the work. I think a lot of people are tired, so it's getting us, keeping us all really energized and out there serving our community.
Thank you. So we have more time for Health and Human Services. My fault. We can ask some more questions here, Carmen.
Okay.
So given Health and Human Services oversight of services to the homeless, what new initiatives are in process to address the needs of the homeless?
Okay, so we partner heavily. I'm sure everyone knows Officer Barrett at HPD. So we do have during the winter months from December 1st to March 31st, we have a warming center that is open for the homeless population from 5 o'clock in the evening until the following morning. This year in particular, we've had a lot of cold weather protocols. So as soon as the governor issues a cold weather protocol, those shelters turn into 24-hour facilities. So we staff those facilities for 24 hours for whatever the length of that cold weather protocol might be. In the past, we've also done a warming bus. So working with Connecticut Transit, having a bus that, on Main Street, where a lot of homeless individuals might be passing to get to their next stop, and they can, hop on the bus, warm up a little bit, have a snack, have a drink, either stay there if they want to, or, continue on to wherever they were going. And then here on Vine Street in the old Milner School building, we also have our, which Mike's team has worked tirelessly with us on both shelters and making sure that both shelters are prepared and have the resources that our homeless population would need. But the Vine Street shelter is for women and families, and they fall under the same, cold weather protocol, and are open extended hours during this exceptionally cold months of the year.
And where are the homeless shelters for men, women, and families in the city? And where can they find that information?
Okay, so you can always go to our website at hartfordct.gov and go to Health and Human Services. You can also call 311. You can call 211 as well. And but the families and women's shelter is on Vine Street. Like I don't know the number. It's in the old Milner School building. In the back of the building is where folks can enter. And then our warming shelter actually got moved this year over to Washington Street, and that building as well, is secured and then opened when the shelter is in operation in the evenings and through the night.
Great. Okay, we got a couple of questions from participants. The first one is, what does equity mean for the department, and how do you approach the work with an equitable lens?
So equity for the department is making sure that we're meeting every client that walks through our door where they are and providing the services that they need from where they're at. A lot of times when we have various programs, I think let me back up. What makes us really unique is that we're a health department, meaning that we heavily depend on our data and to really focus on overall community health. but we're also a human services department. So we have a significant human services arm, which means that we're really looking at the social needs of our clients. So if a client comes in for a relocation case, but they have the clothes on their backs and nothing else because everything else was burned in a fire, we're actively looking to connect them to services for clothes, for food, for a roof over their heads, and then linking them to services to then find permanent housing. I think that any department or any agency can look and say, what can we be doing better? And we're actually really looking into that. We're looking at adding more actual social work into the department so that staff, because right now staff is providing a general service, but some clients need just a little bit more. They come to us with mental health concerns, addiction concerns, so while they might just be coming, or we think they're coming just to secure new housing or different housing or temporary housing, they may also be coming to us with some other bigger concerns that really are impacting the way that their overall health. And so we are looking to add more social work supports in the department as a whole to be able to provide more wraparound, more intentional wraparound services for the clients that come here to seek services. That's a very, very abbreviated answer to equity.
Yeah,
Again,
equity is a
another topic we could go on for
equity is a
days, right?
complicated topic. Yeah.
Yeah.
Another question from the audience: do you have any working relationship with the local federally qualified health center clinics?
We absolutely do. They're a significant partner to us, particularly around the Ryan White HIV work. They were significant partners to us when we were doing teen pregnancy work. And during COVID, we actually have worked very, very closely with Charter Oak Health Center, with Community Health Center, with CHS to, not just to put money out into the community, but also to help them support the community by helping them increase the number of vaccination and testing sites that they've had throughout the city. We often, if we get a phone call from a resident that's in a pickle, and we know that we can't address their need, we have a really a direct pipeline to our community health centers, our FQHCs, to be able to get clients what they need and vice versa. So we have a very strong working relationship with them.
Great. There's another question, a little more practical matter about a lost vaccination card. How do you receive, I guess means replace a lost vaccination card administered from a COVID vaccination site in Hartford?
Okay. So it depends on where you received your vaccinations from. So if you received your vaccination at Dunkin' Donuts Park, for instance, then it was likely a vaccine that was given through us, through our department. So if you give us a call or if you stop by, we can actually look your information up in one of our 2 systems that we use for vaccine management. And once we find your information in those systems, we're able to produce a new card for you.
Okay, let's see. Here's another question. Why or when should residents reach out to the HHS department? Where are HHS locations around the city, and what services are provided at these locations?
Perfect. So let me first, before I answer that question, David, if there is a link to a website called CT Wiz, and that website is basically allows residents to research their name and their own account. And what CT Wiz will have is their entire immunization record. So not just their COVID vaccine record, but it'll also have their any other vaccine that they may have received in the state. So that's a really, really good resource. I don't have the link right now, but I know that when we send out our testing and vaccination sites, often that is a live link that is there. So I will send that to Marion so that Marion can send that out, but that's another way that you can access the vaccine information. If you still need a card, you can bring that paper to us, or you can just come to us and we'll look it up for you. So the other question is, I mean, people come to us. So we have our main location is at 131 Coventry Street. It's part of the, the community calls it the Bergdorf building. So that's what it's most well known as. We actually have the entire ground floor of that building is the Health and Human Services Department. You can look up individual department or individual division phone numbers online at either the city's website or on Facebook. There's links as well. So that is, where our main facility is. We also, like I mentioned earlier, have a WIC office over at on Main Street at the Hispanic Health Council. So there's a WIC office there, and WIC right now is still seeing clients virtually, but in the next few months, we'll be moving back to in-person appointments. They also just opened up their Saturday appointments again. So they will be seeing clients on Saturdays as well. And then oftentimes you can find us out in the community. So next Saturday, there'll be a bunch of us running around throughout the North and South End with vaccine information. But if, you can come by if you have questions about services, or you can also call our main line at 860-757-4730. And you can leave a question there for us, and one of us will get back to you. You can also always call 311 if you have an issue that needs immediate attention. If it's related to blight, rodents, a food establishment concern, I really do recommend going through 311, because that allows us to track the case and then make sure that the case is resolved from beginning to end. I hope that answered that question.
Hope so. All right, thank you. How are you connecting with local artists in the community that can provide family programming which can educate, impart knowledge, helping to address the social emotional supports needed?
That is a loaded question, and I would love to answer it for you, particularly because my husband is an artist. However, that function no longer falls under our department. That would be a function of the Department of Families, Children, Youth, and Recreation. I know that they're heavily involved in a lot of that community programming and programming for young people out of their various facilities.
Okay. What types of opportunities for those who are available to support elders with technical supports they can be connected online?
I'm not sure if I understand that question.
Yeah. What types of opportunities for those who are available to support elders with technical supports they can be connected online? I guess it's about supporting elders and getting connected online. Do you have any services for that?
There is, and I am blanking. There's a program that specifically does some of that work. I can reach out to our North End Senior Center, because I do know that they've been working with a small grant that has been helping them sort of update their technology. And as they've done a lot of work, our senior centers have done a lot of work through the pandemic, trying to help seniors stay connected virtually. So there are, like I mentioned earlier, there's some, Tai Chi classes that are still online and virtual. There's some, movement classes that have been online and virtual, and those I believe are archived in, on YouTube. But in terms of helping seniors, being able to actively help them sort of navigate their own technology, I would have to get back to you with the response, with who exactly that would be.
And how are you including those who are not vaccinated but participate by being masked and testing negative? In your services it's referring to.
Well, I mean, it's an ever-changing landscape. And so, in our office, we are in a medical facility, and so our staff remain masked while we're here, unless we're in our own offices by ourselves. And patrons who come, and residents, people who come to our facility, whether they're seeking our services or services upstairs at the clinic through St. Francis Hospital, are expected to be masked right now. I will say that with the landscape changing, with different mask mandates being dropped, picked up, it's an ebb and flow. I will say that we do know that the research shows that regardless of your vaccination status, masks do help. We do see the data, and we see that people who are unvaccinated and unmasked tend to have, worse health outcomes than those that are vaccinated. So I think it's just paying close attention to the ever-changing landscape. Mayor will make his decisions about, the overall policies in the city based on our data and our information that we're receiving. So those meetings, those data meetings happen once a week. Every Monday, we're sitting down, we're meeting, we're talking about the data, who's hospitalized, who's not hospitalized, how much of our community is currently reporting that they have COVID. And much of our decision making is based on that. And of course, the economic well-being of the city as well. So there are many, many variables that play into that as of right now. And like I said, Liani's been out of town, so I'm sure that next week, given all that has happened at the state legislature, there'll be some shifts in the way that the city is expectations around masks and vaccinations are rolled out as well.
Okay, thank you. We have time for about 2 more minutes worth of questions. So if we can't get to every question, answers will be sent out with the follow-up that comes after this webinar.
Okay,
so
great.
one of our attendees is a provider at CHS in adult medicine, and he asks, are there any projects related to improving access to the general health care, more so than vaccinations or specifically the Ryan White patients? He had missed the first 10 minutes of the webinar, so he's wondering about current initiatives to improve overall access and delivery of primary care.
That I think is a much larger conversation that can be inclusive of public health, but also, requires our hospitals and our FQHCs and other clinics and providers in the city in regards to access. I think as we are breathing a little bit through the pandemic, we've got to think about how not seeing patients in person, for instance, has impacted access, right? And has impacted families' abilities. One of the things that we know, we're struggling with right now is that many doctors' offices are saying you can come in person, but you can only bring, a parent and a child. So what happens to that single mom who has 3 or 4 children, all under the age of 6, can't leave them, unattended, but has to bring their 3-year-old in for an appointment. So there's some things around, access that we need to address and really think through and think about as we're building policy and saying, okay, here are the ways that we're going to keep, our staff safe, and we're going to sort of control what's coming in and out of our offices. We also need to think about how that, as we need to think about the equity pieces and what we're telling parents about how they can access those services. So if it means, if it's the difference of a parent bringing a child in for an appointment and leaving her other 3 unattended, that's probably not going to happen. So we've got to think about, sort of the when we're building policy and putting structures in place, we need to think about how that's impacting an overall family.
Okay, thank you. So now we unfortunately need to move on to the next part of our presentation. So the remaining questions will be answered and sent out with the follow-up materials that come after the meeting. So now I guess we're ready to go on to Michael Looney and the Department of Public Works presentation.
All right, well, thank you, David, and thank you to everyone who has joined us this morning on this webinar. Happy to be here representing the Department of Public Works and just giving some oversight into what we do and taking everybody's questions. The Department of Public Works, we have about 211 positions right now, probably with counting vacancies, we probably have right around 200 employees at this point. We're divided up into sort of in gross terms into three areas: operations, engineering, and then architecture. Operations is really the core of our department, which involves street maintenance, the maintenance of the city fleet, both the lighter, smaller pieces of equipment, as well as the heavier trucks. And this also includes all of the police vehicles as well. The fire trucks, they have their own fleet maintenance division that takes care of those. But everything else, aside from the Board of Ed, pretty much comes through us. We also manage and maintain all of the city facilities throughout the entire city. We have our parks division with our substantial parks system that we have throughout Hartford that they're responsible for. Falling under that is also management of our 4 cemeteries that we have in the city: Old North, Old South, Northwood Cemetery up actually over the line into Windsor, and all of that stuff falls under us as well. Sanitation is also a big part of our department, managing the solid waste collection and disposal in the city, both through our operations in going out with our trucks and collecting solid waste, but also managing our transfer station back at 40 Jennings Road. Forestry is a relatively new division for us that's been around a couple of years. We have tree trimmers and the city forester who coordinate all of the tree work that goes on in the city. And then BRT, our blight remediation team, are responsible for maintaining different city properties that we own that aren't necessarily city facilities, but are formerly private properties and other pieces of land that need to be maintained on a regular basis. And they also address blighted properties where we have owners who are not responsive to requests to clean up, remove trash, litter, and maintain the properties in terms of cutting grass and things like that. Our BRT team tackles those problems as well. Engineering, we have our permit office at 50 Jennings Road, where we have all of our sanitation permits related to the transfer station, as well as other permits for street work and utility work. Our flood control division, we have actually, a lot of people don't know, we have one of the most significant flood control infrastructure systems in the eastern United States, which requires a lot of maintenance and a lot of regular monitoring. So that's another important function that we have. We have a geographic information systems project leader who handles all of our mapping and a lot of our data gathering and analysis. Our traffic division also falls under engineering, and that includes both traffic signal coordination, as well as maintaining all of the traffic signs that we have around the city for various situations. We have an annual milling and paving program that falls under engineering, although we have private contractors usually do the actual milling and paving work. Our staff is instrumental in coming up with the plan every year of what streets are going to be paved, and coordinating all of that work with utility companies so that we don't have newly paved roads getting cut open for infrastructure projects on the utility side. And we also manage the streetscapes and sidewalks, sidewalk repair around the city. The architecture sort of tangentially involved in the school building, school construction projects, but primarily within our own capital improvement projects for our own facilities, as well as adding new assets. We've had a number of parks projects over the last couple of years that have been a big focus for that division. So that's generally what they manage is our capital improvement project portfolio. Next slide. Again, this is just kind of breaking out each of the divisions I just mentioned. Our administration, we have our core finance, HR, admin support folks to keep the department humming along. Facilities, in addition to the things I mentioned, we also take care of all the custodial services in our city facilities, and the trades: carpentry, plumbing, electrical, mechanical, HVAC. We have a large list of different projects that fall under those trades that we work on a regular basis. Again, I mentioned the engineering and architecture. Not only does it include the capital projects that we're working on as a city, but various civil and environmental engineering tasks that come up in the course of development projects and other initiatives, and also addressing the issue of environmental compliance in working with DEEP and the federal organizations that oversee those things. Again, traffic. Our traffic team works in concert with the ES&T division at the fire department to maintain the traffic signal system around the city. They are also instrumental in working with outside consultants and with our NRZs and community members to come up with different traffic solutions, such as traffic calming measures, which have been a big focus over the last 18 months. And also what we call signs and lines, which is making sure that faded stop signs are replaced, crosswalks are painted or repainted as needed, and maintaining all of those smaller but very important pieces of infrastructure. Forestry, again, covers both maintenance and removal of trees, coordinating tree planting with some of our partners in the nonprofit and private sector, and then a variety of different environmental stewardship activities. And BRT, again, is maintaining city properties, as well as getting referrals from Health and Human Services for blighted properties to be cleaned up. They also, in the fall and winter, sort of peel off and assist with the leaf collection operations and also the snow removal operations that we have going on during those months. Next slide. Street services is one of our bigger divisions, focusing on pothole repair, curb repair, street sweeping during the months when it's warm enough to do that on a regular basis. Leaf collection, which again is a seasonal November and December operation that we run. Snow operations during the winter, which is obviously a big focus for us right now. And they also get involved in assisting sanitation with illegal dumping cleanups when we have large amounts of debris that somebody has dropped on a city property or in a public right of way. And then we have a number of different smaller individual projects that they tackle as well. And their staff is also critical in supporting some of our other divisions when they are doing larger projects where we need heavy equipment and some more technical expertise. They step in and assist everybody else. Our equipment services focuses on maintaining and repairing the city fleet. They deal with all of the fuel, both gas, regular gasoline, and diesel, and making sure we have adequate supplies for our vehicles. Sometimes our trucks need repairs that are above and beyond what we're able to do at our shop. So our equipment services superintendent coordinates with outside vehicle vendors to have those larger jobs done outside of our department. And they also oversee and recommend purchases of new vehicles and equipment. Waste and recycling on a per person or staff number basis is really our largest division, has about 50 individuals, have their standard Monday through Friday residential service of both trash collection and recycling for housing residential properties with 6 units or fewer. Also bulky waste and e-waste collection falls under their umbrella of responsibility. operating the transfer station and all that goes along with that, and then also purchasing and delivering to residents new trash and recycling carts when residents come in to purchase those. Parks, I think everybody knows the maintenance and upkeep tasks that are involved in keeping the parks looking good. And this includes everything from keeping the grass cut to prepping fields, recreational fields for use, lining the fields, and other tasks like that. As I mentioned earlier, cemeteries is, we have 4 of those that we have a small group that maintains those important assets as well. And we also, on an administrative basis, oversee the field reservation coordination system called MyRec. We work with the Department of Youth and Family Services as well in this regard because of their recreational component. But that is a function that falls under DPW. And as I mentioned, flood control, we have a substantial system of levees, pump stations, floodgates, other infrastructure that needs to be constantly monitored and maintained. And then when we do have flood events, that staff helps perform storm response and manages the system so that the Connecticut River stays where it should and doesn't get into the city. So next slide. Okay. That's the basic overview of our DPW operations, and so just be happy to go to questions now.
Great, thank you, Michael. You have a question about the paving, I guess the paving program. When will the Broadview Terrace Street that runs from Flatbush to Britton Avenue be paved? It's full of potholes and damaging to cars right now.
Yes, I had gotten a notification about that a little while ago. I will talk to our city engineer. Our paving program doesn't start until the asphalt plants reopen, which is usually, depends when the weather actually turns and starts to get warm enough that they can keep it open regularly, which is probably in late April. But that's an area that we'll be looking at. We're putting together our list of streets right now. It's still in draft form of what we're going to be doing in this year's program, and our staff is reaching out and coordinating with the utility companies now. So we're in the process of finalizing that, and we'll certainly we'll have this taken a look at.
Great. It's a question about trees. How are funds garnered into the tree fund and then distributed back to the neighborhoods they are collected from in our city of Hartford? What is the current policy for replacing trees cut down in Hartford?
So the tree fund that we have is actually funded through permit fees and fines that are levied against folks who remove trees without permission, and developers who, if they're not able to plant enough trees in terms of total diameter inches to replace trees being taken down, they can pay into the tree fund. So we have a fair amount of money in there now, and we're actually using that to fund some tree maintenance around the city. It's not a huge amount of money in there. Where more of our two places where more of our tree planting money is going to come from is just the general CIP funds, the capital improvement project funds for the city, as well as the Parks Trust Fund, which is overseen by the city treasurer. There's several $100,000 in there for tree planting. And our current policy for replacing trees cut down in Hartford, we've over the past 5 years since I've been starting as deputy director at DPW, we've had to take down a very significant number of dead and dying trees. And so now we're getting to the point where we've taken down a lot of the trees that could be considered hazardous, and we're sort of switching gears a little bit. Not that we're going to be doing less of that, but putting our full focus going forward more on getting getting trees planted to replace all of this canopy that we've unfortunately lost due to drought, other environmental conditions. Insects like the emerald ash borer have taken a toll on our ash trees. And just the fact that a lot of the trees in Hartford were planted grew back when the city was developing rapidly, which was about 100 years ago. And now they're reaching old age, as any organism does, and that's led to a lot of tree removals that we've had to do. So now we need to go back and replace all that. We have a great tree canopy action plan that's been put together in coordination between our advisory tree commission and many stakeholders in the community, as well as city officials and city employees. And we're trying now to implement the recommendations from that, which have some very aggressive goals and objectives in terms of number of trees getting planted each year. But in that plan, there is an analysis that was done that shows which neighborhoods have the greatest canopy coverage and which have the least. So we're trying to go almost neighborhood by neighborhood, starting with the ones that have the lowest percentage of tree canopy coverage, and find opportunities to get more trees planted in those neighborhoods, and just start working our way down the list from the highest priority, the areas with the least coverage. And that's going to take, a combination of both. The city alone can't do it by ourselves. It's just too massive an undertaking. So we're working with nonprofit partners and with our tree commission and in community stakeholders in terms of trying to come up with plans for how do we incentivize the planting of trees on private property. Obviously, we can handle the municipal property side, but in a lot of our neighborhoods, we have, you take a place like Clay Arsenal, the quote unquote tree belt on some of those streets right off of Main Street as you go north of Albany, it's really tight and you can't get a tree planted in there. And so we have to look at other ways of getting canopy coverage in those neighborhoods. And that, I think the key to that is finding some way to help residents be able to plant trees on their property through some sort of subsidy or coordinated action. Again, that's not something we can do as a city, but we'd like to see a program developed along those lines, and we've been talking about that.
Great. Is that tree canopy action plan available online anywhere?
I believe it is. I can get I don't have the link at my fingertips right now, but I do believe it is online.
Great.
Possibly under our Office of Sustainability in the mayor's office.
Okay. Regarding the flood control responsibility that DPW has, are there special skills or is there a special training for those who work in this area of DPW?
Yeah, great question. Most people don't. You'd be surprised when I tell folks from other communities or talk to other public works departments. Everyone's always a little surprised that we have this very, unnoticed but incredibly important responsibility, given what happened in 1936 and 1938 with two hurricanes that came through and flooded downtown Hartford, at which point this levee system and pump station system was developed. We have several mechanics who help operate the pump stations and to maintain the infrastructure. So there is some specialization. Working with the stuff, with the equipment day to day builds up those skills. But generally sort of a mechanical engineering maintenance type background is good. What we do is we have probably about a half dozen full-time flood control staff. In the event of a flood of any kind, or where we have flooding coming in from the Connecticut River, we have a roster of other employees throughout DPW who have been trained in flood control operations. and it's basically a rotating list. And if sometimes we need to monitor the pump stations 24 hours a day and make changes, either pump a retention pond down or open a gate or something like that. So we in flooding events, we typically keep staff on 24 hours a day. So we have a rotating roster of individuals who have been trained in the operations. That's something I think I want to enhance a little bit more and have some, try to get some more folks there on a permanent basis being stationed there. But that's pretty much the system we use now, and it to this date it's worked quite well.
Okay, thank you. How does a citizen access information on the complete streets plan approved by the city council and being implemented now?
I think that would actually that might be through development services. I believe
I think that's correct. Yeah.
I think it's linked on their website.
Mhm.
But we're very involved with working with development services on the complete streets stuff. So our traffic staff in particular is very knowledgeable about that.
Great. Here's another different question. Are notices sent to residents for e-waste pickup? Is there a certain day that e-waste is picked up in the city? Do residents just place on the street, or is picked up on a garbage day? How do residents get recycle their e-waste in the city of Hartford?
So the first alternative is you can come down to the transfer station and get a residential permit and dispose of your e-waste. In terms of leaving it on the curb, we generally try to have that done on the regular garbage day. Technically, that falls somewhat under the bulky waste system that we have, where you call in to make an appointment. So the best way to get it picked up is to call in, make an appointment with one of our staff, and they'll enter it into the system, and the date will almost always be the date for your next garbage pickup. So if your garbage normally gets picked up on Thursday and you call on Tuesday and say, I have a couple of computer monitors I want to put out, it'll be scheduled to be picked up on that Thursday, 2 days later. If your regular garbage day is Monday and you call on Tuesday, you usually have to wait until the following Monday to put it out for it to get picked up.
But if you do it that way, that would count as a bulky waste pickup, correct?
Yes.
Okay. Is there a hazardous waste disposal schedule for Hartford?
That function is usually handled, I believe, by MDC. I believe the regional water entities handle that. I know growing up in New Haven, the South Central Regional Water Authority took care of that, where you would drive into their parking lot on a Saturday morning, and someone would take all of your turpentine and paint thinner. We do take paint at our transfer station, because we have a service where that paint gets recycled and reused, and the paint care program helps take care of that. But I believe MDC is the one who usually handles the hazardous waste collection days, and they have those fairly regularly. I'm pretty certain there will be one coming up in the spring, in the next 2 or 3 months.
Okay, could you define for the attendees what e-waste would be?
E-waste would be anything, any computer equipment, printers, monitors, CPUs, old TVs, anything that has some sort of electronic kind of chip component to it would be something that would fall under e-waste. Small appliances wouldn't really fall under that category. Those would be more of a bulky waste item. But yeah, that's probably the best way to describe it.
And now back to trees. How can residents of Hartford participate with helping in the tree program? Whether it's reaching out to constituents or helping to plant trees, or what? How can residents help with the tree program?
So for that, actually getting in touch with our city forester, Heather Dion, and expressing an interest to help. Also, I know our tree advisory commission would love to hear from folks who are interested in working on different initiatives that they might be able to do. Our Office of Sustainability as well. Shubhita Kambli, who was our head of that office, has sadly moved on to work for the state at DEEP, but I believe we have a new director there in place, and I think certainly contacting that office would be a good entry point into getting involved into that very important function that we're working on.
And back to e-waste. How is there a way for people who don't drive to dispose or drop off hazardous waste or e-waste?
The e-waste, you can, like I said, you can call in and make an appointment and then put it out. We have an e-waste truck that drives around and picks it up. And of course, there's folks who just throw printers by the side of the road that we have to handle as well. So we have a truck driving around the city checking for things like that, as well as making the pickups that are scheduled. But the hazardous waste, there really isn't a way, I don't think, to pick it up from the residents to dispose of it. I think you really have to go to that MDC sponsored event.
Yeah, there's another question came in about e-waste, an e-waste schedule, but I guess there would be no schedule, would there? You can either schedule a pickup.
Right, there's no, yeah, the schedule of pickup would be how we do it.
Okay. Any other questions? We're just about wrapping up this part of our presentation. I think we've gotten through all the questions for this section.
David, why don't you try question number 10?
Sure. What services are provided to Public Works by Public Works to privately owned vacant lots that are neighborhood eyesores?
Okay, so the way that gets taken care of is usually a 311 request, or a request from a complaint from a resident will come in to our office or through our community engagement office, and of, let's say, a property where the owner hasn't cleaned up, there's garbage, litter, bulky waste on the property, the grass isn't cut. Those properties then get referred to Health and Human Services, who go out and they have inspectors who go out and look at the property. They certify the condition, prepare a report of what they see, and then that has to be communicated. An attempt has to be made to communicate with the property owner to give them an opportunity to cure the condition. That can be difficult. Many of our property owners who are not actively engaged in the community are not actively engaged because they are out of state. I've seen property ownership data from Brooklyn to West Palm Beach, places out in California. But we have to at least make HHS has to at least make an attempt to contact those owners, a reasonable attempt, and have them do it themselves. And if they don't respond, then we can get an order issued by HHS that permits our blight remediation team to go onto the property and do the cleanup ourselves. What we do is we track all of that, the amount of debris that we had to remove, and all of the associated time and equipment use, and we bill that back to the property owner. And essentially, if they're not going to do it themselves, we'll step in and do it to remove the eyesore, but we expect to get reimbursed for that. And so then that gets sort of levied as a kind of lien on the property that needs to be paid off when the property transfers transfers or changes hands. So we wait for the authority of the HHS inspection to be able to go on there onto the private property. That gives us the legal authority to do that. So there's a whole communication process that goes on between the 311 folks and Health and Human Services, and then my staff at 50 Jennings, and a packet gets generated, and our team leader for the BRT crew comes in, gets packets on a regular basis, and then we go out and take care of them.
So what's the best way for a Hartford citizen to report an eyesore or blighted property? Like, is it through 311, or is there another way to do it? Or
it would be 311 because I think, as Carmen mentioned earlier, when you go through the 311 system, it allows us to track it and see how, get information as to how long it's taking us to respond to issues that come up, how many of these type of cases we've gotten, which is a great tool for us in terms of when we go back and say, okay, are we doing this work fast enough? Is there something we can do to speed up the process and get these issues resolved faster? We don't have the data to really do that analysis and figure out where our strengths are and where our weaknesses are. It makes it hard for us to know how to improve services for the residents. So going through 311 always helps us in that regard. And and they're very good at quickly farming out complaints as they come into the appropriate departments and making sure that they don't get missed or get lost in the busyness of the day-to-day work.
And if I could just add, Mike, if we receive a phone call in regards to a blight situation and it hasn't been through 311, we're likely to refer the resident back to process it through 311 so that we can get it in that manner. It really helps us with accountability, and to be able to just really track what's happening and making sure things are kept on top of.
Exactly.
Thank you. Michael, one more question. How do you address the bulky waste created by residents of apartment buildings? Please describe any alternatives that exist for residents to dispose of bulky waste.
So this is something we've been working on for quite a while. We set up an appointment-based system back in, I believe, 2018, 2019. Previously, the way we did it was we sent out the bulky waste truck behind all of the trash trucks on their regular routes every day and just picked up everything that we saw. And there's a substantial cost to doing that, and also just a management of time and labor and equipment that was really kind of an inefficient system. It is really remarkable just how much bulky waste gets produced in Hartford, and it's an ongoing effort that we've constantly got to be working on and rechecking and making sure we're doing a good job at it, because it is quite a lot to manage. The system that we have in place where folks call in to make appointments, and you get 2 free appointments per residential unit for 6 units or less, has been heavily used. A lot of people using it, and that has actually worked out pretty well. The difficulty comes in with those, as this kind of the core of this question, is the apartment buildings with more than 6 units. Technically, we don't service those buildings for any sort of solid waste service. An apartment building with 20 units is supposed to have, a private company, a private hauler come in and take the trash from their dumpsters. And it's the same thing with bulky waste. Property managers are supposed to have someone a vendor on call to manage the disposal of couches and dressers and other material that come with residential units being cleaned out or left behind by residents who have vacated various units. Part of the problem is that we have some very good landlords in the city. We have very good property managers who are on top of things and do this really well. We also have a significant number who are just not. Bless you.
Thank you. Sorry.
And what that really just kind of, it's like a pet peeve of mine. If you have you're owning a property and you're living, in Florida, New Jersey, California, and you're not engaging regularly, and you don't have a competent property manager who lives in the area and can respond to residents' issues, that's a significant quality of life issue for our residents who live in these buildings. And there's a significant number of rental units that fall under this category in the city. And one of the things is being responsible for the solid waste management of your properties. So that's where we run into a lot of difficulty. We'll have folks who I think just feel like they have no alternative because they have a property manager or a landlord who is not regularly engaged, and they don't. A lot of these folks don't have a vendor lined up for bulky waste. It's something we need to address, because then folks are just kind of forced to either put it out on the curb, and then it becomes an issue where we have to try to contact the property owner, which, like I mentioned before, can be quite difficult to get it cleaned up, or we have to issue citations, notices of violations, or fines. And the other alternative for residents is bringing the furniture or bulky waste down to our transfer station. But a lot of our residents don't have access to a vehicle that can permit them to do that, unless you know somebody with a pickup truck, or you're able to rent a trailer or something like that. But that's in many cases beyond the means of a lot of our residents. So it's really an issue of trying to get these property owners who have the larger apartment buildings. And again, like I said, I don't want to paint everybody with a broad brush. We have a lot of good property owners and property managers, but there's a significant number who are just not really paying enough attention to this issue. And it's a service that you need to provide to your residents. So that's been a tough nut to crack over the last couple of years, and something we're going to continue to work at.
Okay, so that's going to have to wrap us up right now. We got a couple of questions in the Q&A. Maybe Michael, you can get in there and answer those by typing.
Sure. Yep.
Appreciate that. Thank you very much, Michael. Great presentation. Thank you.
Well, thank you, David. Thank you, Michael. Thank you, Carmen. And for this has been very informative. And I'd like to turn it over briefly to Lindsay.
Excellent. Thank you, Marion. And thanks, everybody. A lot of really good questions and content today. I'm just going to post a couple of things in the chat window. The first one is the registration for our next webinar, which is on family, youth, recreation, and education. You'll see the link there, which is on March the 5th. And then the one after that is, let me get this right. Yep, is the public safety on March the 19th. We also have a survey from today's session, and we'll be sending it out as well, but I'm just going to post the link in the chat in case anybody wants to get a head start and complete the survey. But we also have taken a copy of all of the questions that were asked and the ones which we were not able to get to, and I'll be sending this to the panelists, and hopefully we can get these answered and sent out to everybody as well. Thank you, Marion.
Thank you. And so Lindsay has covered everything except items 2 and number 3. So the survey, by the way, will only take, there's only like 3 questions. So you could actually do it before, if he's put it in the link in the chat, you could actually do it before you leave today. And that would be great. So a video of this program will be made available. It will be available on our website once it is finalized, and also it will be on YouTube. We're hoping also that Hartford Public Access TV will put this also on their programs. And you will also receive the slides in a follow-up email to you. I'd like to tell you that if you're don't know your NRZ, you can go on our website and go to this link, and you will find your NRZ. I would encourage you to participate in your neighborhood organization to find out what's going on and how you can help. Secondly, I'd like to thank Hartford Foundation for Public Giving for providing us with the resources to make this happen. And then I'd like to thank our panelists today, Carmen Shaparo and Michael Looney. Very informative. We appreciate your time. Today, we also had Alba and Carlos who were going to help us with interpretation if you wanted to say something in Spanish. And also, David, thank you so much for your moderating.
You're welcome.
Lindsay, your help as co-host has been great. And we also wanted to thank our program committee for helping put this together. Jack Antonich, Janice Castle, who many of you know, and Emily Lugo. And we hope to see you at the next one. So sign up for our newsletter. You can go onto our website and look for Contact Us, get our newsletter so we can keep you informed on a number of things. But I'd like to thank you all for today. And I hope to see you again. And again, we'll be sending information out and answers to the questions that you asked. So thank you all, and enjoy the rest of your day.